Thank you very much, Amin, and thank you very much for the very kind introduction. And thanks all of you for joining us today for this short sharing of a few simple tips of what we can do when we're managing road injuries when we encounter them. My name is Raj. I'm a trauma surgeon, as Shaman has mentioned, and I work at the National University Hospital. And naturally, we see a large variety of road traffic accident victims, and it is very useful whenever patients have had first aid rendered on site or first response rendered on site. And it really makes a difference to their survival when medical care is brought right up front. And if it starts even before SCDF and the paramedics arrive, that helps them even more. In my own experience, in driving along the roads in Singapore, for some reason, I do seem to encounter accidents with quite frequency. Encounter accidents which have already occurred with some frequency. And based on that, I just gleaned a few simple lessons and things which I myself, as a doctor, find useful and I think might be useful for other first responders, regardless of your background, whether you have medical training or not. So without further ado, I'll just quickly touch on a few aspects. And we'll probably keep more time for questions and answers at the end. And I'll just touch on a few basic principles. So we'll just talk a little bit about first what happens when you first arrive in an accident scene, what you do. And secondly, we'll talk about a few specific aspects about looking after a patient who has been traumatized. And what do you do thereafter, after the ambulance arrives as well. So starting with that, so let's start with a simple case scenario, and this is not an uncommon scenario, where you're driving along or you're in a vehicle or you're walking along and you see a car crash into another vehicle. Driver is stuck, there's liquid draining onto the road, you think there's some smoke, and what do you do? And there are many, many different options depending on what you think is your particular aim in this scenario. On one side, you may have people who may try to approach a vehicle to try to get him out because they're worried that there's going to be an explosion. There may be others who would prefer to let the experts come in and call 995 and await an SCDF response, and or there are others who may get involved in various other ways. And really, I think it's important when we think about these scenarios, the aim is not to be a hero, but the aim is basically to be able to help the casualties the fastest and the best and most effective way possible, at the same time of protecting yourself and protecting others as well. So I'll talk a little bit about scene management and safety. So when you first arrive on at an accident site, I think the first thing that you got to talk about is how is it safe to approach the accident site? Is it safe for yourself? Is it safe for others as well? If you're on your own, if you arrived on your own vehicle, and let's say you were driving and then you saw an accident, or you're in a Grab and you saw an accident, first you do want to make sure that you park your vehicle some distance away so that you don't get in the way of ambulance services and other emergency response services approaching the vehicle. So you don't want to get too close with your own vehicle. Park it a distance away, switch on your hazard lights, make sure it's not affecting traffic. And there are multiple roles you can play depending on when you first arrive at the scene. And some part of it may be important to divert traffic, if you know how to, placing the warning triangles that are available in many vehicles to kind of steer people away from the accident site. And again, of course, alerting SCDF and the pre-hospital services as well. I think it's very key that if there is a safety concern, that you do not approach a casualty. You don't want to make one casualty situation a multiple casualty situation if the field is particularly very dangerous. In the scenario that we discussed earlier, this happened in Singapore, where someone pulled a gentleman out of a burning car and heroically managed to save this gentleman's life before the car exploded. And again, this would be more the exception rather than the rule of what we would advocate, because it puts yourself at quite significant personal risk if you do something like this. And again, as I said, you may be converting a single casualty event to two. Of course, at the spur of the moment, we can never tell what we would do at that point in time. And some of us may feel that, no, we want to go in and we want to try to engage and help them as best as we can. But I think it's important when we're doing this, to have a very good idea of situational awareness of what's happening around you, what are the immediate threats, And especially if you have some training, which we'll talk about later on, that will really help you if you need to intervene in a very emergent manner. Of course, once you arrive on scene, a very important thing is going to be about calling for help. And often I find that in my own experiences, when you're involved in an accident, when you approach an accident scene, there are usually quite a lot of different people who are going to be there already. There are going to be various bystanders, you're going to have other vehicles who have stopped to help, and there may be someone already performing first aid. So when you first approach a scene, I think you'll first ask yourself, what is your role going to be? Is your role going to be someone, if there's clearly no one who has taken charge of a situation, then your role may be that of a leader. Your role may be to say, okay, I think this is what we need to do. I think I need someone to help divert the traffic away. I think I need someone to quickly call 995 if you have not alerted them already. I need a few of you who are first aid trained to quickly go down, especially if you know who's there with you, or if not by asking people around. Or if there's someone who's already in charge, then you go in to say, how can I help? I think what's important is that you don't want chaos in a situation like this, and you want to be able to actually try to help the best way you can. And being aware of what's happening around you is very important. So when you first approach a scene, if you see that someone's already doing first aid, just go and offer go speak to the person, say, I also know first aid, what else can I do to help? And they may advise you to do some different things. Or if you're the first of the scene and people are coming in and thinking of what to do, then you can use your survey. You can then say, okay, why don't you go ahead and try to divert the traffic away? Why don't you call 995, create a space around the area, go get a particular item. And these are things that you can do. So be aware of your role when you reach a scene. And there's a lot, and this is a very important part, which over the years I found to be crucial in actually trying to get a good response whenever there's a significant accident on the roadside. Of course, when you're calling 995, it's very normal to feel very agitated when you first call them. The first time I called 995 on the roadside when I encountered an accident, I have to say probably I was a little nervous when I was calling, not knowing what exactly to say. What I've learned over the years is just basically just speak slowly and clearly. Oftentimes, 995, the dispatch will actually guide you as to what to say. They'll ask you specific questions, so just listen out for those. But broadly, what they want to know is your identity, your location. They'll ask you a number, and don't get agitated if they're asking you these kind of questions and not talking about the accident directly, because this is very important for them to localize where things are going and to make sure that they have established a contact on the ground. So don't just keep interrupting them, going straight to talking about the accident, but really take your time to basically tell them exactly what's going on. And in these are situations where talking slowly is actually faster than trying to just blurt everything out. So and essentially what they want to know is they want to have a description of the accident, the scene, the number of casualties if you are there, and also your own capabilities. Are you first aid trained? Do you know how to do basic cardiac life support? Is there an AED around? All these are important pieces of information as well. But speak clearly and slowly with them, and that will really save you some degree of time as well, and also help the paramedics in triaging the situation and to determine how many people need to come down to the scene, for example. So now let's get to the crux of it. As a first responder, what do I do? And I think this is where there's a lot of uncertainty. Certainly, guidelines over the years have changed, and a lot of it depends on what your own training and what your own background is. For those of us who have some degree of medical backgrounds or have gone for first aid courses or first responder courses, sure, there's a certain role that you can fulfill. But even if you're not, even if you haven't gone for anything before, and this lecture is the first, or this session is the first time you have actually thought about being a first responder, then what can you do? So first thing I would say is get yourself ready to help. Now these days, most of us have masks somewhere along in our vehicles, on our person, if you're on public transport, useful to wear. If you have gloves for any reason, and it is useful sometimes to, if you have a first aid kit and you have some gloves in them, you could use them as well in order to avoid too much getting blood on splashes on you. I would say the majority of us probably don't have gloves lying around when we approach a scene. For those of us who have your own vehicles or driving, having a first aid kit around is a first aid kit is actually very useful. And even if you don't, even if you just have some clean cloth or clothing, bring those along from your vehicle or from your bag, because that can be useful. Bring your handphone along in case you need to call 995. And of course, again, as mentioned, review your safety when approaching the scene. First aid kits can be obtained from a variety of places, but essentially the key items that you're hoping to have is some degree of bandages, plasters, and that will be very useful when you initially approach the patient. Some of the more advanced ones may have tourniquets and other kind of devices, but usually you need a bit of training for those as well before you get to use them. Now, so I'm going to just go through a few scenarios, and again, some of it is drawing on my own experiences when I see people at the roadside. So let's say you have a casualty in the car. There are a couple of possibilities here. Sometimes a casualty can be stuck in the car. That means they can't be extricated, and they're really just stuck in where they are. They can the windows may be broken. There may be glass all over the place. He may have bleeding. He may see that he has got a wound over the head. The airbag may be deployed. His seatbelt may be stuck, and there are lots of different variations to this. I think the first thing is, first of all, ensure safety. Make sure there's no glass lying around which you're going to be stepping on. Make sure the car is not in imminent danger of, if it's smoking or if there's a fire, really putting that out should probably be the top priority before anything else. If the safety check is clear, then first of all, as you approach the patient through the window or through the open door, checking whether it's conscious, responding to your calls or taps. Do not rock a patient violently because it may be tempting to do so if he's not responding, but you don't want to worsen any injuries that he already has. And really just tapping them or calling out to them would be useful. If he's alert and he can talk to you, identify what his injury, where does it hurt, where his injuries are, and he may be able to tell you, oh, my leg is very painful, my neck is very painful. If they're very alert and they're not stuck and they want to leave the car, that's perfectly fine. Just assist them as they are leaving the car and let them walk out of the car. That's fine. However, if they are extricated and if they are stuck and require extrication, clearly I wouldn't advise trying to do anything with your bare hands to try to get him out, and leaving it to the SCDF, who do respond very, very quickly in Singapore, is probably the best bet. In more advanced cases, sometimes if you have the ability to provide some degree of first aid while the patient is entrapped in the car, you may do so, including the use of dressings over wounds which he may have. If he's unconscious, supporting the airway may be useful, and this can be simply done by just holding his head steady while waiting for the paramedics to arrive, while they can put on a collar and then they try to get him out, especially if he's stuck in the car and he's unable to extricate himself. So quite a few different things that we could do while they're there, even if you can't get the patient out of the car itself. There's rarely a need to get into the car itself to do anything at this point, unless there's an area of significant bleeding and you have difficulty assessing that from the driver's side and you need to get into the car. Otherwise, it's really quite rare that you need to do that. Now, if you're a motorcyclist, oftentimes most motorcyclists, when they are found, their helmets may still be on. Some of them the helmets may have come off during the accident, so be it. But do not try to remove the helmet on your own, because removing the helmet on your own would require some degree of moving the patient's neck and the casualty's neck. And when you try to do that, you may end up worsening a spinal injury that he may have. However, many motorcycles, especially the full-face motorcycle helmet, especially the full-face ones, have a visor. And moving the visor off gives you access to talk to the patient and to assess his breathing and for other injuries there as well. So just for motorcyclists, just be a bit careful about that. Motorcyclists sometimes can be flung quite a long distance from their vehicles itself. So you may see a motorcycle, but you don't see anyone there. Do look around for where they could be, because they may be quite a distance away sometimes after a high impact accident. All right. Now, I think a very common question that is asked is, should I roll a casualty over? And for example, if they are facing down, what should you do? If they are lying flat, what should you do? Now, the main worry about patients who are unconscious is whether they're able to maintain their airway. So if they are unconscious and they're not responding to you, then whether they'll be able to actually whether they're able to maintain their airway, because the tongue tends to fall back sometimes, that becomes a little bit challenging for them, and leaving them in this situation may cause them to still have an obstructed airway. So at the same time, turning them just and putting them in a lateral position, which is a common teaching in the many first aid courses in trauma patients, could put them at risk of spinal injury as well. And you would need quite a bit of support if you were to do this. Now, if a patient is still able to, if a casualty is still able to talk to you, they're breathing normally, then it's best to leave them flat in a prone position, in a supine position, and also to perhaps prop up their, not prop up their head, but to use cloth or rolls around their head to keep them steady so that they don't have inadvertent movements of their neck, because they probably would have a high likelihood of a spinal injury, and they would probably require a cervical collar, which most first aid kits would not have and a bystander would not have, and you would have to wait for the paramedics to come in to help you put that on. Now, the unusual situations would be in a patient who is supine or lying flat, but has problems with his airway. And this is especially when you have lots of blood pooling in the mouth, when he's unconscious and his breathing is being difficult. Then moving him to a recovery, or at least a lateral position, would be important, but you do need quite a lot of people to help you with that. And this involves trying to move the patient so that the spine is constantly in the same alignment. This requires some degree of training, and unless you're able to give clear instructions to your fellow responders, this is not as easy as it looks. And trying to do this wrong may end up worsening a spinal injury as well. So you have to be a little bit careful with these kind of casualties and what we do with them. The other aspect is, of course, bleeding, and I think this is the other very common thing that you'll encounter in a trauma patient. External bleeding often comes from the limbs. You can also get it over areas with very good blood flow over the face and the scalp, because these are areas which are exposed. Bleeds over the trunk are possible, and especially if there's any bit of penetrating trauma, that means if there's some part of a spike or a pole which is impaled on them, certainly you could get a fair bit of bleeding there. Generally speaking, there are two broad ways to stop bleeding: direct pressure or the use of a tourniquet. A tourniquet is basically a device which is used to reduce the blood flow to a particular area. So if you have bleeding over the arm, applying a tourniquet higher up would then help to reduce blood flow down to the arms. And there are lots of different campaigns which have been looking into this and how to encourage this use in the community. The Stop the Bleed campaign is a very popular campaign in the US, and it's getting a lot of traction around the world to teach everyone about how to stop bleeding, especially when you encounter it. And the very basic measure is actually just to apply direct pressure over a wound. It means if you have either putting your own arm or using a bandage or using a clean cloth directly to press on an area of bleeding. And really that's probably, for a layperson, the most effective way of trying to help. It's sometimes not so easy because it may be a large area. Sometimes the pressure you apply may not be enough. Sometimes a patient may be complaining of a lot of pain with the pressure that you're applying over, let's say, a broken bone, and that too can be problematic. Second is the use of hemostatic dressings, and these are dressings where you can actually stuff into wounds which are open. But again, most first aid kits don't really contain them, and so unless you have some training on this, you're probably not going to be using that so much. A tourniquet is probably one of the more useful things which are out there now to help with bleeding from the limbs. And these are not just simple rubber bands or things that we tie around the limb, but these are actually devices where we can exert a high degree of pressure to reduce the flow through the arteries which are going to the limbs. And this really helps to try to reduce some of the blood flow to that area. Again, if you don't have a tourniquet, then probably the direct pressure is probably the best thing that you can do at that point. And if you don't have a first aid kit, as I mentioned, for bleeding, just really any clean cloth would do. Clean clothes would be fine to use as compression. Should I use my belt as a tourniquet? It's often been described using belts, towels, and all that. But many studies have shown that actually they're not very effective. All these improvised tourniquets are not very effective in controlling, especially what we call arterial bleeding. In fact, I think some studies only show about 50 to 60% of them perhaps have some use in controlling arterial bleeding. But it is better off if you don't have a proper commercial tourniquet just to apply compression while waiting for a first responder. And in fact, SCDF and a lot of our first responders now carry tourniquets with them so they can quickly deploy this in the event that they are activated and they have to respond to a casualty. Now, I think one aspect that we always don't talk about when we're talking about first aid is really about the fact that many accident victims are going to be very distressed. Most of them can be crying, some of them can be crying in pain, some of them could be shocked that all of this has happened. Some of them could be very agitated, they'll be worried about what's going to happen to their vehicle, what's going to happen to the job they're going to, things like that. And I think one aspect which we don't talk about sometimes is just the simple calming effect you can have by showing that you're in charge and that you're looking after them. And I find that makes a world of difference, actually. Bringing your own calmness into the situation helps to calm the patients down and really helps them to better relay their symptoms to you and to be more cooperative, especially when things are so painful for them at that point. And so it's also important then as first responders that we think about controlling our own anxiety as best as we can, simply because it is very effective when you are anxious. The patients tend to get, your casualties tend to get very anxious as well. Now, what do you do after the ambulance arrives? Once the ambulance arrives, the ambulance crew, which is usually a crew of 3, will come quickly down and they will immediately start their assessments. I think and it's a great relief whenever you see our SCDF warriors come in, because you know that they're a very professional group. They will take charge and they will get the patients to where they need to be. But I think there are a few things that you should do to facilitate the process. So identify yourself early to the paramedics, especially if you're right next to the patient. Tell them that you're the first responder who has been responding. Tell them briefly what you know of the accident, your involvement so far. And I find it very useful to tell them what you have discovered as well, what the patient has conveyed to you about injuries and what injuries you have discovered, and also what have you done. For example, have you applied a bandage over an area? Have you applied compression? Have you, for example, applied a tourniquet? And these are very, very crucial for them. At the same time, the paramedics have a job to do, and they have a clear protocol about what to do when they first approach a patient. So don't delay their access to the patient as well. So talk to them while they are doing their job, because they will be very focused on ensuring that they get the patients rapidly assessed and ready for transport. So again, don't delay the access to the patients, and again, follow the instructions. There are not many occasions that you have to follow the paramedics in the ambulance. There are some times where I've done that in a number of occasions, but not very common. Most of the time they have it well on hand, and unless they need a specific pair of hands, usually they will just take your details after that to contact you thereafter if they have any other questions of what has gone on so far. And what do you do then after you have gone home? Well, I think one thing is make sure first you wash out all your debris, blood from your body, your hands and all that, especially before you pick up your children and your loved ones. And I think it's important also to take a moment to reflect on what has just happened. That you have been involved in the care of an accident victim, how it has impacted you, and how you may want to respond the next time as well. Because I still remember the first time I responded to a roadside accident, I was very nervous, and I'm thinking now, looking back, I think there's a lot more I could have done as compared, and I'm certainly a lot more prepared now compared to the first time when I responded to an accident on the roadside. And I think it's important to share your stories with others as well, so that they too know that, this is not just, if you see an accident, there is a role for a first responder. There is something you can do to improve survival, to comfort, and at the very least, to comfort the patient in their time of need, and certainly inspire them to do so as well. And sharing your stories normalizes this kind of behavior and doesn't make you just an outlier. And of course, I think signing up for first aid courses, and there are a number of them all around. In fact, SCDF themselves run a very important course, which I would encourage many of you to attend if you all haven't been to, which is our community program, which is CEPP. And on top of that, there are many different agencies all around, which include lots of useful tips. Sometimes it's not just on the medical aspects, but also on how you respond to other emergencies as well. And I think it's really valuable for anyone to go for this. And even if you're in the medical line, and for those of you in the audience who are in the medical line, going for these programs sometimes does give you an additional perspective about approaching these kind of scenarios and what you do, especially if this is not part of your daily work. There are lots of useful skills apart from just BCLS, but including bandaging, how you do that properly, simply putting out a fire, which is really quite useful as well. So yeah, so those are just a few simple tips that I had for you today. So today I think we've talked a little bit about the basic approach, what happens when you first approach a patient, when you approach the scene, about scene safety and what you do, as well as what you do when you're contacting the paramedics, and simple things about how to stop the bleeding, how to look after patients who are not breathing well, what you do, whether a patient in a car, in a motorcycle, whether you turn them over, and certainly, of course, what you do after SCDF gets there as well. So we're happy. I think we have quite a bit of time for questions as well. So maybe over to you, Shamin.